Okay, welcome back dear friends. I am Dr. Klim Raza. Today's lecture is going to be very important lecture because we are going to discuss the bones of the vertebral column, the basic applied in clinical anatomy. What is basically the function of the bones of the axial skeleton? When we are talking about the axial skeleton, it's meaning we are talking about bones of the skull, vertebral column and the rib cage. So the function of this vertebral column is to preserve, is to secure your part of the central nervous system, the spinal cord, and the function of the skull bones is the protection of your brain, which is the master system of your body. When you are talking about the vertebral column, the backbone, the spine, it consists of total 33 vertebrae. You have got 7 cervical vertebra. This is the anterior view. Here you can see this is the anterior view of spine, this is the posterior view, and this is the lateral view. So in this way, this is a lateral view, you can view from lateral side. This is a lateral view. You have got 7 cervical vertebrae. You have got 12 thoracic vertebrae. You have got 5 the largest and strongest lumbar vertebrae, and you have got the wedge shape, sacrum bone with the 5 fused vertebrae, and you have got this tailbone, the coccyx, with the 4 vertebrae. We are going to start right from the cervical vertebrae, especially the most important ones, the C1 and C2. So first cervical vertebra, and that is called as atlas, and second cervical vertebra, that is called as axis. So atlanto-occipital joint, very important joint. It's mean a joint between your first cervical vertebra and the occipital bone. Here you can see this is your occipital bone. So atlanto-occipital joint, very important joint, and this joint is basically the example of biaxial condylite synovial joint. So you may write here in this picture you can see all vertebrae, and this first vertebra, first we are going to discuss the characteristic features of cervical vertebra. So this first vertebra is a cervical vertebra, and the cervical vertebrae, what are the characteristic features of the cervical vertebra we will discuss, but first we are talking about this first joint, the joint of the atlas with the occipital bone, the atlanto-occipital joint. This is example of biaxial condylite synovial joint. And what are the movements here? The movements are the flexion of the neck and extension of neck. Flexion and extension. So this is biaxial condylite synovial joint, and this movement is basically possible because of the atlanto-occipital joint. So remember this please. Yes, and no, this movement is possible because of the atlanto-axial joint, which is basically also synovial but uniaxial. Atlanto-axial, the joint of the atlas with the axis, and this rotation of the neck, this is possible because of the special tooth-like projection of C2 vertebra, that is called as dense process. So remember please the atlanto-occipital significance and atlanto-axial significance. And among all these 7 cervical vertebrae, the strongest one is the C2, which is the axis vertebra. You should must write all these high yield points in your notes. These are frequently asked question in your exam. And then another typical feature of the cervical vertebra, that is the transverse foramen. Here you can see this foramen, this opening hole, special hole. This is a transverse foramen. So the structure passing through transverse foramen, that is the vertebral artery. What is the significance of the transverse foramen? That vertebral artery will pass through this transverse foramen. So let me show you another structure where the vertebral artery, here you can see in this image, very important artery, the vertebral artery. Vertebral artery. So here you can see this is a vertebral artery. Vertebral artery is passing through these transverse foramens of the cervical vertebras. And vertebral artery, another very important question, that vertebral artery is basically coming from which artery? Here you can see this is your subclavian artery. So this is the left subclavian which is directly coming from arch of aorta, and this is the right subclavian which is coming from brachiocephalic trunk. Remember please. So vertebral artery is a branch of which artery? Another very important question, that vertebral artery, this is a branch of the subclavian artery, and more specifically you have to understand the significance of the vertebral artery, that vertebral artery will going to supply your posterior brain. Here you can see this is the vertebral artery, and vertebral artery right and left and forming the basilar artery. So posterior inferior portion of the brain is basically blood supply is coming from the vertebral artery, and another branch of the vertebral artery, that is basilar artery. I have explained complete blood supply, the circle of Willis. Lecture is available, you can watch that lecture on the blood supply of the brain also. So remember, all cervical vertebra having special transverse foramen, and which structure is going to pass through the transverse foramen? The vertebral artery, except C7. The C7 transverse foramen is very narrow, and vertebral artery is basically not passing through C7 transverse process. Remember this exception please also. And then when we are talking about the largest spinous process, so C7 among all these cervical vertebrae, C7 spinous process is the largest spinous process, and you can feel this is a prominent spinous process right at the base of your posterior neck. And what are the other features when we are talking about the intervertebral disc? So here you can see, we will discuss in second part of this lecture about the intervertebral disc, that between two vertebrae you have got intervertebral disc also, which act as basically shock absorber. So among cervical vertebrae you have got also the intervertebral disc. So if there is a swelling of the disc or the herniation of the disc, ultimately there will be compression of the nerve roots, and swelling or the herniation is common especially at the lower end of the spine, especially the intervertebral disc of the L4, L5 or L3, L4. But in cervical portion, remember the disc which is commonly degenerated or swell, that is the disc of the C5, disc of C5 and C6, C5 and C6. So from this portion, the C5, C6, your brachial plexus is going to originate. So anyone having disc herniation among C5, C6, it's going to press the function of the trunks of the brachial plexus, and it's going to give you the symptoms and signs in upper limb. So anyone is having pain, neuropathic symptoms of the upper limb, upper extremity muscles, this area, it's basically innervated by brachial plexus, so it's mean the compression lies more specifically between the disc of the C5 and C6, remember. And then when we are talking about thoracic vertebrae, also remember that most commonly fractured, that is also the C2, and especially during the hanging, this is also called as hangman fracture. During the whiplash injuries, automobile accidents also, when in case of the hyperflexion or hyperextension, C2 fractures are also frequent fractures. You have got total 12 thoracic vertebrae. 12 thoracic vertebrae, and thoracic vertebrae are very important vertebrae because they also help in the articulation of the rib cage. So the costal facets. So nature have given you 12 pairs of the ribs and 12 thoracic vertebrae. All ribs are posteriorly attached with the body of the thoracic vertebrae. And then special feature of thoracic vertebra body, that body of thoracic vertebra is basically, here you can see, this is heart shape, and their spinous process will be very sharp. Here you can see very sharp spinous process, and body is heart shape, and here this is intervertebral foramen through which your spinal cord is going to emerge. And then when we are talking about the lumbar vertebra. These are the strongest and largest vertebras, and body of lumbar vertebra is basically the kidney shape, and their spinous process is thick, sharp spinous process. This is feature of the thoracic vertebras. Thick, this is basically feature of the lumbar vertebras, and they are having strongest and largest body to bear your body weight. So disc herniation, remember disc herniation, let me show you the disc also. So here you can see this is basically the intervertebral disc, which is also rich in the proteoglycans, the collagens, and it acts as shock absorber. And inside here you can see this is your spinal cord, and these are the spinal nerves, and total there are 31 pairs of the spinal nerves. So right from the base you will have brachial plexus, and brachial plexus is innervated your upper limb. Then thoracic spinal nerves you have got 12 pairs, and then you have got lumbosacral plexus, and remember you have got 7 cervical vertebrae and 8 cervical spinal nerves. So C8, this is the 8 cervical spinal nerve, remember this also. So lumbosacral plexus is going to innervate your lower limb, the pelvis region, and your posterior compartment of the thigh also, and largest nerve there will be the sciatic nerve. So common disc herniation are the fracture of the disc, dislocation of the joints, herniation or the bulging of the disc is most frequently occur basically between L4 and L5. Spinal cord usually end at first lumbar vertebra, L1. Remember these bony landmarks also. Spinal cord will end at L1, subarachnoid space will extend up to S2, trachea will start at the level of C6. At the level of C6 trachea will start at the level of C6, and it will terminate in front of T4 and T5 intervertebral disc, in front of T4 and T5, that is the sternal angle also. And then at the level of T12 you have got aortic opening. So these are important bony landmarks. So which intervertebral disc is commonly having the hernia or common risk factor for the dislocation of the disc is disc of the L4 and L5. So L4, L5, if disc is swelled, it's going to compress these nerve roots of the lumbosacral plexus. So patient will complain pain of the posterior thigh and then leg compartment because of the compression of the nerve roots of the sciatic nerve. Remember, this is the basically combination of the tibial nerve and common peroneal nerve. So remember this also, please. And then in this picture you can see your rib cage, and this midline joint, manubriosternal, and this is xiphosternal. All midline joints of the body are basically secondary cartilaginous joints also, and these intervertebral disc also the example of the secondary cartilaginous joints. So first 7 pairs, these are the true ribs, but 8th, 9th and 10th rib, they are attached with the 7th costal cartilage which is fixed with the body of sternum. These are called as false ribs. But posteriorly all ribs are attached with the body of the thoracic vertebra, remember also please. And extra rib that originate from transverse process of the C7, that is called as cervical rib, and cervical rib in some cases will lead to compression of the roots or the cords or trunk of the brachial plexus, and patient will have symptoms, and it may lead to blockage of the subclavian artery in this region. So if subclavian artery is blocked, patient will have weak pulses because blood supply of the upper limb is coming from subclavian artery. So if you will block the subclavian artery, patient will have weak pulses. If you will compress the roots of the nerves, patient will have neuropathic symptoms. So that is common in extra rib that originate from transverse process of C7, and that is called as cervical rib. And these symptom signs syndrome is called as thoracic outlet syndrome. thoracic outlet syndrome. Thoracic outlet syndrome. Thoracic outlet syndrome, the compression of the roots cards of the brachial plexus with the compression of the subclavian artery, and all these signs symptoms in combination, this is called as thoracic outlet syndrome. And in some cases you will see, if this sternum is inwardly grow, that is called as pectus excavatum. That is called as pectus excavatum. And if your breastbone or sternum is outward like pigeon chest, that is called as pectus carinatum. Pectus carinatum. Pectus carinatum. Pectus excavatum inward, pectus carinatum outward. And then you have to understand some spine deformities also, like what is the scoliosis, what is kyphosis. Let me show you another structure. In this image you can see that this is basically the picture of the scoliosis. This is the lateral or outward curvature of your spine. Lateral or outward curvature of your spine, this is called as scoliosis. And when from thoracic portion your spine is outward growth, or the outward curvature of the spine at the thoracic portion, this is called as kyphosis. And it may be common because of some postures also. And when spine at the lumbar portion, lower end of the spine, is inwardly growth or inward curvature of the spine at the lower end, especially at the lumbar end, this is called as lordosis. So remember these abnormal postures of the spine also. So we have started from the basic clinical anatomy of cervical vertebra, then I have told you significance and typical features of thoracic vertebra, and then the lumbar vertebra. Then you have to understand what is basically the significance of the thoracic vertebra, that all ribs are posteriorly attached with the body of thoracic vertebra, and what is difference between true ribs, false ribs and flatting ribs, and what is the cervical rib, what is thoracic outlet syndrome. I hope this lecture was helpful to understand the basic and clinical anatomy of the spine. Thank you for your consideration. Thank you.